Hello, my name is Jerry Lewis, and I want to talk to you just a little bit today about a problem that we all know about, and that is suicide among teenagers. Um, Suicide is a major problem in the United States, and a lot of times adolescents suffer from anxiety and depression because of just relentless bullying at school, at home, wherever they go. There's all kinds of different types of bullying, such as cyberbullying and actual physical bullying. But the problem is the same. It affects people throughout their whole entire life. Um, the presentation purpose, next slide please, is to evaluate the effect of psychosocial interventions as compared to treatment as usual in relation to reoccurrence of suicidal ideations related to bullying. The significance of this problem is that bullying among vulnerable populations has been documented to cause large amounts of anxiety and depression, and bullying is one of the primary causes of suicidal ideations in adolescents. Next slide. Suicide is one of the leading causes of death worldwide. Data suggests that 800,000 individuals take their life each year. Professional organizations such as World Health Organizations have named a reduction in all types of bullying as a key preventative component for the combating of anxiety and depression that often leads to suicide in teens. Next slide, please. In this presentation, I chose a theoretical framework, and I chose Gene Watson's theory of caring. It's based on 10 caring processes. They're listed on this slide. This framework will help you find evidence that will result to guide the delivery of interventions for combating suicidal ideations. It's a holistic approach and healing promotion of each patient using interventions that are most likely to create success in the patient. Next slide. A thorough literature review analyzed data from all available sources to determine how psychosocial interventions impacted suicidal ideations. There was 3 levels of evidence research. One was level 1 that was conducted in 2017. The second was level 2, a randomized control trial conducted in 2016 by the Department of Psychiatry at the University of Michigan. And then there was a qualitative study conducted in January 10th, 2020 at Johns Hopkins University. Next slide, please. The purpose of this systematic review was to identify health and psychosocial problems associated with bullying, victimization, and to conduct a meta-analysis summarizing the causal evidence. Interventions such as CBT-based psychotherapy, case management were studied. The authors reviewed over 8,231 articles, assessed for eligibility 165, satisfied the predetermined inclusion criteria for meta-analysis. Excuse me. Next slide, please. Systematic review results concluded that there was convincing evidence for causal relationship between bullying, victimization, anxiety, and depression. Poor general mental health, non-suicidal self-injury, suicidal attempts, and suicidal ideations. Clients that suffered bullying have a higher rate of suicidal thoughts and depression, as well as continued mental health and physical problems. So next slide, please. Level 2 evidence, a study investigated psychosocial interventions, particularly to identify health and psychosocial problems associated with bullying victimization. The purpose of this study was to analyze how certain psychosocial intervention modalities affect reduction of suicide ideations. Evidence results, adolescents were recruited from, this research posed questions such as bullying involvement, social connectedness, and suicide risk, and subtypes of bullying involvement and suicide. Patients that receive CBT treatment are more likely than not to abstain from suicide versus patients without treatment. The qualitative study was done at Johns Hopkins University It was performed, did a qualitative study. The study examined the results of bullying and suicide in 83 countries versus just one region. Treatment for patients suffering from SI, and it concluded that there was convincing evidence for a relationship between bullying and victimization and anxiety and depression. Next slide. In the simplest of terms, the study identified publications on the risk of suicidal behaviors and the association of being bullied. No study has examined the association of being bullied with suicidal behaviors in adolescents across gender, countries, and World Health regions. This study examined the results of bullying and suicide in 83 countries versus one region. This study concluded that CBT is an effective treatment for patients suffering from suicidal ideations. The combined outcome of these studies showed a promise among certain interventions, such as CBT psychotherapy. The study provides more or less hopefulness to patients suffering from suicidal behaviors. This information helps to prepare researchers to investigate further interventions for these issues in order to achieve and to improve our evidence-based practice. PMHMPs must continue to shape our care upon evidence revealed by these studies. Future research will reveal the results that matter to patients, as well as interventions that are most appropriate to achieve their goals. Proposed intervention. Next slide, please. The implementation of certain psychosocial interventions should be enlisted into the treatment of the patient struggling with anxiety and depression. These feelings often lead to suicide. The interventions proposed in this study will work across a vast spectrum of psychosocial issues. As mental health providers, our primary focus must be the health and well-being of our patients. It is our duty as providers to always utilize proven methods of treatment for our patients. Next slide, please. In conclusion, there is evidence suggesting certain CBT interventions can be successful in reducing anxiety and depression, as well as suicidal ideations in teens in as little as 6 months. CBT-based psychotherapy may lead to fewer suicides. Further investigation of the effect of CBT interventions must incorporate the faulty assumptions about mentality behavior, so that as PMHMPs, we can further comprehend the results that matter to our clients. Thank you for your consideration of this video. The references are included. Thank you and have a wonderful day.